Alright guys, today we are going to talk about Hydromorphone, or its more common name is Dilaudid. And again, Dilaudid, really great drug. Boy, it does make things better. But we're going to talk more specifically about, again, what we use the Dilaudid for. I know that in critical care we used it a whole lot. On the street level, it's being used. The biggest reason we're starting to use it a lot more is that a lot of people are already desensitized to narcotic pain medicine. So with that being said, again, we're going to use it in people that are opiate tolerant. And when they have a lot of moderate to severe pain, we're definitely wanting to use this drug. Now, this comes with some good and some bad. It's again an opioid analgesic, and again it's a narcotic agonist. So it activates the pain relieving system. It competes for the receptor sites. The biggest thing that we have the problem with, though, is people abusing it. And with that being said, again, we walk into the room and immediately they go, I want something for pain, and it starts with a D. Uh-oh. Well, it means that they probably already know about this. So again, the biggest thing that it also does is it causes respiratory depression, just like any narcotic does. But remember, this stuff is 8 to 10 times more powerful than the standard morphine dose. So obviously, it's going to definitely interrupt the mu receptors. It's going to interrupt. It's going to cause a lot of respiratory depression from it. And again, it does have a lot of it causes a lot of nausea, vomiting. So usually when we give Dilaudid, you give a Zofran with it or some sort of phenergan with it to keep it calm. Now this stuff actually takes about 15 to 30 minutes to work, but it lasts for about 2 to 4 hours. But again, it's very effective at controlling pain, especially when your pain is like a burn pain or a broken arm, broken leg. This stuff really works really well. As with our narcotics, we know that they're going to be some the same things that we would have, let's say, with a morphine or a fentanyl. We're also going to have with Dilaudid. Again, I wouldn't call these side effects. This is kind of what it does. It makes you drowsy, makes you sleepy. Again, every now and then people can have a reverse reaction, a little dysphoria. The biggest thing is it causes some bradycardia. And that's usually related to the respiratory components. So again, watch out with your blood pressure. Again, Dilaudid will drop your blood pressure. Again, and respiratory depression, that's a really big one. And in some rare cases, it actually can cause either laryngospasm or bronchospasm. And again, that can make things very difficult very quickly. Again, nausea and vomiting, again, constipation, it is an opiate. So if they're using a lot of Dilaudid, it's going to stop up the pipes. Again, we try not to use it with ladies that are nursing or they're in labor at that particular time. But we got to watch out for patients that has asthma with this drug, especially if they got a history of status asthmaticus. This stuff can really tighten up, cause bronchospasms, and again can cause some major issues. Again, this stuff reacts with the medicines, the Verseds, they increase the effect, especially alcohol. If the person is intoxicated on alcohol, this stuff will really do a number on them. We shouldn't give it if they've had some sort of alcohol ingestion. And again, the good news is when we do give it in an RSI situation, it actually helps us. Because again, it helps the neuromuscular blockades action of, let's say, a SUX or a VEC. So we do use it, and that's a good thing for that. Our reversal agent for this, again, it is a narcotic, so therefore Narcan will be working on it. And again, watch out with your older patients. And the biggest problem is everybody slams this drug, and you can't slam this one. This one's got to be given nice and slow. Because if not, you're going to cause a lot of hypotension. You're going to cause a lot of the side effects to happen. The respiratory depression is also going to happen. As dumb as this one sounds, yeah, unfortunately, Dilaudid is extremely habit-forming. So again, we usually, the biggest one that I've seen is this vial. Usually they don't do the big vials of this stuff, especially in pre-hospital. And we give it 1 to 4 milligrams, and I can't stress this enough, slow IV push. Slow, slow, slow. Make sure your blood pressure is above 90 systolic. I would probably want it just a little bit higher than that, just in case. And for peds, again, we do not use it in the setting. And again, our routes is IV, IO. We can give this IM if we need to. And though it's a pregnancy class C, just remember we talked about it earlier that we really don't give it to the ladies in labor or if they're nursing at the time. Originally the clip I was actually looking for was from Look Who's Talking. So when they give the mom the pain medicine and the baby's all floating in the womb. All right, well that does it for Dilaudid. Hope this helps, guys, and I will see you next time.